Today, CDC is releasing its initial guidance for the public that, for the first time, lays out some of the activities considered safe for those who are fully vaccinated. When I say fully vaccinated, I mean people who are 2 weeks after their second dose of either the Pfizer or Moderna vaccines, or 2 weeks after a single dose of the Johnson & Johnson vaccine. Robust clinical trial data demonstrate that the current COVID-19 vaccines are highly effective at protecting vaccinated people against severe illness, hospitalization, or death from COVID-19. However, there is still a small risk that vaccinated people could become infected with milder or asymptomatic disease and potentially even transmit the virus to others who are not vaccinated. Understanding the size of this risk in vaccinated people and the risk of transmitting the virus to others who are not vaccinated is an ongoing area of research. CDC recommends that fully vaccinated people can visit with other fully vaccinated people in small gatherings indoors without wearing masks or physical distancing. Remember, here we are talking about private settings where everyone is vaccinated. So what does this mean? If you and a friend or you and a family member are both vaccinated, you can have dinner together, wearing masks without distancing. You can visit your grandparents if you have been vaccinated and they have been too. Now, I want to talk to you about another more complicated scenario. It involves vaccinated people visiting with unvaccinated people. CDC recommends that fully vaccinated people can visit with unvaccinated people from one other household, indoors, without wearing masks or physical distancing, as long as the unvaccinated people and any unvaccinated members of their household are not at high risk for severe COVID-19 disease. If an unvaccinated individual or any unvaccinated member of their household are at high risk for severe disease, everyone, regardless of vaccination status, should still wear a mask and physically distance and choose to meet outdoors or in a well-ventilated space. This is recommended to keep the individuals at high risk who are unvaccinated safe. Similarly, when fully vaccinated people are visiting with unvaccinated people from multiple households, everyone should wear masks and physically distance and meet outdoors in a well-ventilated space. CDC's new guidance also recommends that fully vaccinated people do not need quarantine or get tested following a known exposure to someone with COVID-19 as long as they are asymptomatic. At this time, the CDC is not adjusting current guidance on travel. We believe these new recommendations are an important first step in our efforts to resume everyday activities in our communities. However, we remain in the midst of a serious pandemic, and still over 90% of our population is not fully vaccinated, though we are working hard to get there. Therefore, everyone, whether vaccinated or not, should continue to avoid medium and large-size gatherings, as well as non-essential travel, and when in public spaces, should continue to wear a well-fitted mask, physically distance, and follow other public health measures to protect themselves as others. In summary, fully vaccinated people can visit with other fully vaccinated people indoors without wearing a mask or physical distancing. Visit with unvaccinated people from a single household who are at low risk of severe COVID-19 disease indoors without wearing masks or physical distancing. And refrain from quarantine and testing following a known COVID-19 exposure if the vaccinated person remains asymptomatic. I want to stress that we continue to have high levels of virus around the country, and more readily transmissible variants have now been confirmed in nearly every state. While we work to quickly vaccinate people more and more each day, we have to see this through. Let's stick together. Please keep wearing a well-fitting mask and taking the other public health actions we know work to help stop the spread of this virus.